You've been diagnosed with rheumatoid arthritis, and I bet you've never been told that you can live to 100 years with rheumatoid arthritis. I'm Dr. Asiya Mubashir. I'm a US trained internist and a rheumatologist, and today we're going to talk about just that. But first, if you like my channel, please hit subscribe, like, and share. Rheumatoid arthritis is not wear and tear. It is an autoimmune condition in which your own body begins to attack your joints, causing pain, inflammation, and swelling. And what is interesting is that for the longest of time, data has shown us that patients with rheumatoid arthritis die earlier than patients without it. But that has changed. A large population study looked at thousands of patients with rheumatoid arthritis and showed us that patients diagnosed after 2000 live just as long as the general population. This gap had closed, and there are 4 reasons behind that. And if you follow those 4 reasons, we're gonna live up to 100 years with rheumatoid arthritis. Number 1, control your disease. This is the absolute foundation. You can do everything on this list, but if you do not do that, it simply doesn't work. The goal today for rheumatologists is not to control pain, but it is 0 pain and 100% function. This is what we call treat to target. A 20-year follow-up study showed that patients who were treated early and aggressively, especially within the 2 years of their diagnosis, had the best outcome and the least amount of joint damage. But you have to take your medication. You also have to minimize steroids. Number 2, protect your heart. Cardiovascular disease is the leading cause of death in patients with rheumatoid arthritis. In fact, because of ongoing inflammation, patients with rheumatoid arthritis are at a higher risk of developing heart disease than the general population. In fact, according to the European Society of Cardiology, they now identify rheumatoid arthritis as an independent risk factor for cardiovascular disease, just like smoking and diabetes. So a lot of times my patients ask me, how do I know I'm protecting my heart? So here's what you can do. Number 1, know your numbers, check your blood pressure. Number 2, always check for diabetes. Number 3, make sure your doctor is checking your cholesterol. Number 4, weight management and exercise. These are cardioprotective. And number 5, if you smoke, stop that today, because that is the single best thing that you can do for yourself. The EULAR, or the European League Against Rheumatism, recommends that every patient with rheumatoid arthritis should have a cardiovascular risk assessment every 5 years. If your doctor hasn't done it, ask for it. Number 3, watch for complications. Now, this is very important. Rheumatoid arthritis can sometimes cause lung disease. This is known as interstitial lung disease, where the inflammation in the joints can proceed into the lungs and cause inflammation there, as well as scarring. And sometimes patients may not have any symptoms, but if you have dry cough and you're short of breath, please talk to your doctor before you blame it on anything else. The other complication I want to talk to you about is infection. Patients with rheumatoid arthritis are on medications called immunosuppressants. These medications can lower your immune system and increase your risk for infections, and therefore vaccinations become very, very important. Number 4, treat the whole person. Now, living to 100 is a great goal, but our goal is not only to live long, but to live our best lives. There are things that you can do to treat the whole person in patients with rheumatoid arthritis. And the most important thing is definitely bone health. Patients with rheumatoid arthritis are known to have a high risk for fracture, what is called osteoporosis. So this can easily be prevented by checking patients with a bone density scan. The other thing that we want to do to make sure that you live your best life is to look at your mental health. Patients with rheumatoid arthritis and depression live less than patients with rheumatoid arthritis without depression. So this is a very important conversation to have with your rheumatologist. Finally, what is really important is cancer screening. All patients with rheumatoid arthritis should be screened for cancer, what we call age-appropriate cancer screening. If you have rheumatoid arthritis, you may qualify for colon cancer screening, for prostate screening, breast cancer screening. please talk to your doctor. You now have all the tools to live up to 100 years with rheumatoid arthritis. I'm Dr. Asia Mubashir, and I'll see you next time.